Then let's make a scenario. Let's simulate. This is the scenario. The patient is your patient as a neurologist in Cleveland Clinic. You're going to, discuss with him, and you're going to refer him to, our also colleague who is a neurosurgeon, Dr. Tanmoy. Yeah? Then Dr. Tanmoy, what's next?
Yes. So I'm a neurosurgeon. My role is very limited in the patient's journey, but I believe it is very impactful. So as Shiva mentioned, 10% of these patients will need surgery. How we do it? We first sit down with the patient to set the expectations. What all symptoms will improve, what all symptoms will not improve. Then I sent our patients to Dr. Lian. She has an evaluation of the patient's psychological status, memory, which she will tell us later. Then patient comes back. We do a very sophisticated MRI, just specific for this particular procedure. It's like a GPS MRI to help us, to navigate us exactly where we want to reach. The margin of error has to be less than a millimeter. I repeat, less than a millimeter. So if you are away from by a millimeter, you will not get the same result. So we use intra of neurophysiology, intra of imaging techniques, and then we reach the target. The next challenge is the programming part, which Shiva will explain again. So we are doing this surgery for more than 20 years, but the technology is not the same anymore. It has advanced significantly over last 20 years. So now we can actually modulate at the symptoms exactly what the way we want. Say for example, patient wants that when he's going out having tea, he doesn't want his hand to move. When he's coming back home, he's relaxed and his anxiety level is low at home, so he needs less support. We can exactly, based on his requirement, we can organize, we can regulate the parameters in such a way it can be synchronized with patient's daily schedule. Next, we can check the brain sensing. We know what signal comes out for the Parkinson's patient. Now, when we start the stimulation, we see that the stimulus, the machine is able to read that, the sensing from the brain, and able to change it. So this is exciting, very, very exciting, that based on exactly, it's very precision medicine. It's a very patient-centric, tailored approach, exactly what is needed for that particular patient. So the technology is evolving in such a huge way. It's very, very exciting. You might have heard Elon Musk has last week disclosed that he has made some exciting advancement of the Neuralink. So we are waiting for this new technology. We already are using, maybe something more will come. So there is many things going on, and I have to thank the engineers, the technologists who are making it possible. It's a combination approach, it's a teamwork. I play, as I mentioned, a very small part, but it's a very impactful part.
Thank you, Dr. Tanmoy. Can I ask you, what's the place of AI and the intervention of AI in your work as a neurosurgeon? And I know that Cleveland Clinic is the only, in fact, organization doing it in UAE.
Thank you so much, Dr. Fatma. Yes, AI will be having significant role. The way it is like now, as of now, not really. I will say we are already adopted some of the AI technologies in our practice. But more and more, once we place the stimulus, we need to program it. We need to fine-tune it. The AI can have a significant role in adjusting this fine-tuning to find out what patient did. Patient leaves our clinic, comes back to our clinic 3 months. So AI can track the patient that what happened to this patient's 3 months. Out of 3 months, when he was bad or she was bad and when she was okay. So what are the points we can address and to make the quality of life even better? So AI will have a significant role here.
Looks good. You are in the right place with M42 then.
Perfect, exactly.